Hi, this is Dr. Antelak from thegentlendentist.com in Shelby Township, Michigan. In case you're interested in about implants, our phone number is 586-247-3500. Today we have Kristen, and she's agreed that we can record this and put it on YouTube. And what I wanted to do is to mention this is about dental implants that we're using to replace a root canal that she had, and then she had surgery on it and it never worked out. And so if we look over here, this is where she currently is. Or we took this tooth out about 3 weeks ago, and she went to a specialist, and they tried to fix it, and it was not able to be repaired. And so we extracted that around 3 weeks ago. And tell us what it was like then and what it's feeling like now at this point.
It's a sense of relief after the tooth was pulled out. I had felt like a heaviness in that area, and I could feel my finger running over that spot right above in the gums. I ended up with an abscess, so that's when I came in. Otherwise, I wouldn't have known anything had gone wrong with the apicoectomy before. But it's like a weight off my shoulders now that the tooth is gone, because it's been years of issues with it.
Yeah, so it's been a long period of time when this has been a chronic infection. So by taking it out, giving it a chance to heal initially. But if we wait too long, how it is with implants, if we wait too long, then actually the volume of bone, the width of the bone starts shrinking down to, even at 6 months, you get like 50% shrinkage of that bone. So we're going to be doing it now today. Let me show it to you.
So we went ahead and provided adequate anesthesia for Kristen at this point. And we are just going to go ahead and create what's called the osteotomy, which is basically the hole that is going to be used for placing the implant. This is done, we do in sequential sizes as we get larger and larger to form enough. It's almost like a wood screw that goes into the bone. This is done so that we can make sure that when we tighten it up, it has enough torque and ability to hold in her. This is also the implant that we placed in her mouth. We'll go ahead, and this size, it comes actually on a piece of a little abutment thing that we can tighten up on it, and this gives us the ability to hold it in place without affecting the titanium surface, which has been sterile, completely sterile as we place it into the bone. So now we're putting into a driver that goes into so this is going to go almost like a screwdriver, and it's going to go right in there, and I'm going to go ahead and place it in with some pressure and a lot of accuracy when we're going ahead and putting that in. So we're just torquing it in place right now, little by little. She's not feeling any pain right now either. She's just feeling me pushing a little bit, because bone does not feel pain. And right now at this point in time, we've actually placed the implant in her jaw, in her mouth, and we're going to just go ahead and unscrew what's called the abutment part, which is used as the crown eventually, the part that you're used to seeing. Let's say if a tooth had a crown for a natural tooth there. So you can see this right now is the abutment as I'm removing it, and we're going to go ahead and just take it out. So this is how it works. She's going to be spending about maybe a couple days, maybe have a little discomfort or a little pressure, but that should be about it after this is done, believe it or not. Like I said before, most of the pain comes from the fibers around the bone. This is the implant abutment, as I was talking to you about. That will actually be modified so that we can give the most aesthetic result possible. So at this point in time, we've completed this process, and I'd like to show you what it looks like to have the implant placed, including the abutment. The abutment is a metal piece, as we can see right there, that is actually torqued into the implant, which is the screw that goes in there. That will act to support a crown, an aesthetic crown, and we're going to actually make a temporary right now that she'll go. So we'll finish that up in about 4 weeks or so, and we'll let you know what it looks like then.
Okay, so here we are a few months after with Kristen that we had gone ahead and completed the implants healing really well. We've had a temporary on that we're trying to nurse that along till her insurance renews in January.
Yep.
And so we just remade the temporary. And maybe let us know how you've been doing with it and how the implants been feeling.
No pain. No pain at all, especially afterwards. I was worried about having to take heavy, any type of heavy medications as far as pain relievers. I just took Motrin. There's no pressure, no pain during the entire procedure. It's been going great.
Yeah.
Yeah.
So all that pressure you had when you had the
Gone.
all that pressure and all that infection
Yeah.
was gone. That was a long
Gone.
time too. It lasted for a long time.
Mhm. Yeah, it was definitely a weight lifted off my shoulders, and it's nice to finally not have to worry about that tooth anymore.
So we're looking forward to putting the other one in and treating it like your natural tooth. So if you have a tooth that's missing or one that's been chronically giving you problems, just give us a call at 586-247-3500. Thanks.
Thank you.
That's it.